When we think of protecting our hearts, most people think of cardio, so walking, running, or biking. But did you know that lifting weights could be just as important? Today, we're going to jump into the science behind strength training and your heart health, and the results may surprise you. I'm Jason from Regeneration Fitness. This is the last video in our Strong Hearts, Long Life series. If you haven't already, go check out the other 3 videos, hit the like button, subscribe to the channel, hit the bell for notifications, and with that, let's talk about some resistance training. Strength training isn't just about building muscle. According to a 2023 scientific statement from the American Heart Association, resistance training can help with blood pressure, cholesterol, blood sugar, and overall body composition, even if you've already been diagnosed with heart disease. They said, for patients with hypertension, coronary artery disease, and heart failure, resistance training helps reduce symptoms, improve stamina, and boost the quality of life. The American Heart Association recommends resistance training 2 to 3 times per week, 8 to 10 exercise of moderate weight, and have a focus on all major muscle groups. You don't need to lift heavy, but it is all about consistency. So going beyond the American Heart Association, you can find numerous studies out there that show the benefit of resistance training when you have a chronic heart condition. For example, in a 2022 meta-analysis of 17 clinical trials, patients with chronic heart failure who did resistance training showed big improvements in the following areas. They improved their VO2 peak, which is a key measure of cardiovascular fitness. They walked nearly 50 meters farther in the 6-minute walk test. They got stronger in the both upper and lower body. Best of all, there were no negative effects on the heart structure. So strength training didn't just make them feel better, it actually made their heart work better too. So now we're going to combine this video with our last video, which was about aerobic exercise. In a 2024 clinical trial, they compared aerobic exercise alone to aerobic exercise plus resistance training in patients with coronary artery disease. Here's what they found. Both low and high load strength training added to aerobic exercise significantly improved VO2 peak, which again is a key measurement of cardiovascular health. The high load group, which is more resistance training, heavier lifting, gained 17% more lower body strength. Even the low load group saw a 10% increase in strength. The cardio group alone, just 1%. So strength training accelerated this recovery, improved their heart, but it also gave patients strength to move confidently. So now we're going to tie it into our second video that we did and how do you get started safely. First, check with your doctor, make sure that you are cleared to do a resistance training program. Once you are cleared, start slow and start smart. Start with body weight exercises. Those are a great place to start. Things like sit to stands or wall push-ups. Any little bit helps. Aim for 2 times a week, maybe 15 to 20 minutes a day. And again, make sure you're hitting all parts of your body, all major muscle groups. So if you've been skipping strength training because of your heart, turns out strength training can actually be beneficial to your heart health. My recommendation is to do both resistance training and aerobic training. As I said earlier in the video, shoot for 2 to 3 times a week for resistance training, hit all the major muscle groups. Aerobic exercise, go back, check out video 3 of this series where I talk about aerobic exercise. I go over kind of where you want to be for that. And let's stop thinking about resistance training as optional because it's actually essential to healthy aging. If this helped you, don't forget to like, subscribe, and share with someone who needs a stronger heart and stronger future. If you haven't already, check out the other 3 videos in this series. This is our last video for our Strong Hearts, Long Lives series. Be on the lookout for our next series. Be on the lookout for future videos. And in the meantime, I will continue to help you be fit, be free, and be you. Thanks, and we'll see you next time.